It's good to see you. I'm sorry that I don't get to see you in person. Can you hear me okay?
Yes, hi Vanessa. It's
I can't
lovely
hear
to
you
see you.
though. Are you by any chance on mute?
No, I'm not on mute, but I'll sort it out. Give me a
No,
minute.
no, I hear you now. You are good.
All
Um,
right.
I'm glad we're connected, and I'm going to take a quick moment just to introduce our session, if that's all right. You probably, I don't know if you can see me or not, but I'm happy to
I
see
can see you.
you. Okay. Good morning, everyone. Good afternoon, good evening, depending where you are in this world. I'm really excited about this session, primarily because of who we're having a conversation with and because of her extraordinary championship of many, many issues, conversations, actions, justice, things that we need in this world today more than ever. Because I think it goes without saying, this is probably the understatement of the century, but we are really coming out of the worst shock that we've seen since at least the Second World War, if not in some ways, given the range of globalization, our size of our connectivity that we've seen in modern history. There are millions dead, and there are many more that are suffering the trauma of the last 3 years every day. And that's not just the trauma of having gotten sick, but that's about falling below the poverty line further. It is about the inequality we have seen for women as they fall back and we've lost the gains that we've seen. It is about the people who are more vulnerable, the rise of migration. It is about all the ways that we have seen the impacts from this pandemic and the way people have behaved and the power structures that we've seen. And so it's absolutely appropriate, it is right, and it is necessary that the global community is reflecting on what we could or should have done better, but frankly, what we need to do from this moment forth. And in particular, we know that the pandemic really threw into sharp relief the startling inequalities extant in global health and in how our world works today. Issues of equity, gender, race, sustainability, power, and inclusion are all key to unlocking the progress that we want to make on health and well-being. And none of it happens without people, without partnerships. And we're at a tipping point. We are truly at a tipping point today. And we have to take bold action to change the way of doing, or the old way of doing things. I can think of no one better to lead us in this conversation and to help guide us in this moment and to wrestle with us in this unknown than Winnie Byanyima. She is a passionate and long-standing champion of social justice and gender equality. She's the executive director of UNAIDS and an undersecretary of the United Nations. She leads the United Nations efforts to end the AIDS epidemic by 2030. She believes, thank God, that healthcare is a human right and has been an early champion of the people's vaccine against the coronavirus so that it is available and free of charge to everyone around the world. And that's where I first really had the privilege to connect with Winnie and to work alongside her. As a global leader on inequality, she has co-chaired outside of the health sector as well, which I think is important within the World Economic Forum. She served on the World Bank's Advisory Council on Gender and Development, the International Labor Organization's Global Commission on the Future of Work, and the Global Commission on Adaptation, bringing the critical importance of health into all of these other sectors because health is fundamental to everything that we do. And I think what I love, one of my facts I love about Winnie is that she's also the first female aeronautical engineer from Uganda, which is not an easy feat on any level. And she holds what I think is one of the most important titles and one that I'm honored to share with her, which is that she is a mother. So I guess I'd like to just start with something that is really close to my heart, slightly self-serving if it is okay, but health workers. Because as we emerged from a global pandemic, the same nurses, physicians, community health workers, and health workers of all different cadres who were heralded as heroes, had pots banged for them, were clapped for amid all the shutdowns, are today continuing to show up in systems that too often aren't equipped, aren't staffed, aren't structured to adequately serve the community's needs and those that are most vulnerable. And we need to invest in our health workforce, especially women in their leadership, where women are 70% of the healthcare workforce, 90% of the patient-facing workforce positions, but only 25% of the leadership positions. And so how do we turn the tide and invest in our most critical resource, which are people, when it is not the trendy investment or really one that is fully understood to make?
Thank you, Vanessa. But you're frozen.
Am I? You're not frozen, so keep talking.
Okay. I thought you were still talking. But thank you so much for inviting me to this conversation. And Vanessa, I admire your global championship, being a global champion for health workers, and particularly women health workers who are the majority of health workers. Look, I will start with a woman I met and who stays on my mind. She's called Juliana. She's a community health worker in an informal settlement called East Lee in Nairobi. Juliana is in her early 20s. She's living with HIV. She's a survivor of sexual violence. She managed to get on treatment. She's alive and well and has two sons who are HIV negative. So she was able to benefit from the science. And now she's a community health worker. She links women, usually very young women, many times teenagers, to the health center in her community. She counsels them when they are found HIV positive on how to stay on treatment and have healthy babies that are HIV negative. For all this work she does, being the link between her community and the health center and saving the lives of many babies and mothers, she gets paid $20 a month. That is the stipend she's given as a volunteer. She's considered a volunteer, community volunteer. This is the face of community health workers that I know, that the majority of community health workers in the world today are either unpaid or underpaid. Their work is not valued as it should. It's even invisible, yet it is life-saving. They face the risks of being on the front lines, and they're just not counted in the global health system. This is also true about the rest of caring work, healthcare work that happens in the family, in the community, that it is done by women, by moms, by sisters, by even grandmothers. And this unpaid care work contributes to the global economy trillions of dollars. But that too is not counted in the global economy as work. So you find where women work in the care sector, caring either in the formal health system itself or in the informal setting of family and community, that their work is not recognized, is not valued, is as it should, and is not remunerated. This is a global problem. And it stems from the other point you made about leadership. If the leadership in global health is dominated by men, like you just said, 25%, how can we ever expect that the contributions of women to global health will ever be valued and made and remunerated fairly? Of course, it won't happen. So the question of leadership in global health, in healthcare, is so important. And getting women to lead there is not rocket science, because they already are there. They are there because they have been trained, first of all, socially to care through their socialization. They are trained because they go into the care sector and get trained as nurses, as doctors, so they can also be leaders. They're just excluded because of the patriarchy. And we need to open the space for them. It's political will, it's not rocket science. So pushing and pushing for the leadership of women in healthcare is critical, because it's not only about a human right to themselves, but it is about how the whole healthcare system is seen and valued. Who would not say that the work of Juliana is life-saving? How can it be called how can it be treated as just voluntary? Until we have the leadership of women, we will not, in key positions of in the global health space, from global to national to community to local government, we will not solve this problem of structuring health services to meet the needs of all people, men and women and children, and others who are non-binary. So leadership. Should I pause there? Because I talk too much, Vanessa?
No, you don't talk too much. I'm sitting here though. I mean, I have many questions I'm ready to still ask you too, because I think that as you're articulating some of the problem, right? And you're articulating the need to make this transition, and you're talking about poor leadership. And I would argue we have a pandemic of bad leadership in the world today. The question then that I would like to ask you too is though, what are the levers that get pulled to change that dynamic, right? How do we take this problem, the recognition you said, 3 trillion of our global, economic input is from women, women in the health workforce add 3 trillion to our global economy, but only half of that goes paid. What are the levers though that we have to pull to actually truly see that actionably change? Because I think that's the question, I'd love to hear you elaborate on too, because you've deep experience in being an activist and being a policy or an advocate for policy change and helping to see those policies change. And your leadership in the People's Vaccine was profoundly needed to at least gilt some of the shifts that did finally happen. And we're not there yet, and I will ask you about that in a moment. But tell us a little bit about where you see the opportunity for everybody listening here today to go forth and help to create that action.
Vanessa, on this question of what we value and what we want to invest in because we value the health of our people, the education of our children, and all of that, we need to go back to the definitions of what is economic progress, socioeconomic progress. There is a project going on now at the United Nations on measuring the global economy beyond GDP, to look at what are we measuring. We can't just measure growth of economies and count that as socioeconomic progress. We must value more and have a better measurement of whether we are progressing. Lives are being saved, people have health, kids have education, people have housing. These things need to be part of a global measure of economic progress, socioeconomic progress. In this project, it's so important that we build in there the work that feminists have done for many, many years of proposing how to value the unpaid care work that women do. Because our weakness, women's weakness in decision-making, whether public or private sector decision-making, our weakness in the global economy where we earn, generally there's a huge wage gap globally, the fact that men own more wealth than women globally, all these things actually stem from our subsidy we give to the global economy by doing so much unpaid work, caring work, which we love. We love to care for our kids, for our husbands, for our communities, but by not counting it as important for the economy, that these people we care for are the labor force that produces the goods and services, by not counting that, we are cheated. So reviewing the way we measure the economy, we measure progress is important, and that's a project that's going on, has been going on, but we need to bring in that feminist perspective of how to value what women do, because we don't only go out there to teach and to build roads like men, but we also care, and care has value too. So that is part of the solution we need. But beyond that, we also need to get to do what you do, that challenge our governments about how they remunerate people in the formal system. Care services cannot be valued as less important as putting up a building, that a construction worker can earn more than a nurse, than a child carer in a creche. Why? We need to see that the work that women invest in is valued as well as the work that men do. We see silos in labor because women tend to be in care areas, but they are underpaid.
Yeah.
And men go into some sectors that are more infrastructure related and so on and get better paid. That can't be right.
So here's another fun one for you that is not right. The COVID-19 pandemic highlighted the challenge of local production. I'm very excited for your answer on this. And especially on local production capabilities in Africa, where the continent is still currently importing 95% of its essential medicines and more than 80% of its medical supplies and equipment. For example, PPE, which is needed for innumerable number of diseases. This is absolutely unsustainable from a cost standpoint and efficiency standpoint, and without question unacceptable from a health equity standpoint. So to improve health outcomes, to be better prepared for the next pandemic, but I would argue also to embrace that value system that you're talking about, that well-being agenda that is being championed at the UN and I think really is going to be the crux to sort of unlocking a lot of the answers that we need. We know that Africa needs to boost its production capabilities. What realities, though, do we have to confront when making the case for investing in Africa's pharmaceutical and medical supplies production sector? What are the pragmatic and courageous solutions that we need to take forth? And what are the power structures that we are really struggling against that are deeply entrenched and historical?
Vanessa, that's really a very important question of today, and it's urgent. I'm sitting here in Washington, D.C., by the way, and I'm here for the IFI spring meetings. Mm-hmm. These institutions are key here, but they are not the only ones that are key. We saw during COVID, we learned some sad lessons. One, that you can have a life-saving vaccine, but that millions can keep dying and without access to it. And all because the rules allow it. The rules allow companies to monopolize a technology, set the price where they want, sell it whoever they want, and take as much profit as they want at the cost of lives. The lesson there for some regions, particularly Africa, that were excluded from accessing that life-saving vaccine was that we must build capacity in every region to produce the technologies that are needed at any time. And that capacity in Africa was very, very low. The African leaders came together and said, never again. We are setting a target. By 2040, we must produce 60% of our own health technologies. They've set such a target. But setting a target is one thing, reaching there is another. You are right to ask the question, what will it take? And that question is not just for Africa, it's for the whole world, because we saw how the virus respects no borders, was spreading across, and every country was affected. And unless we could lift everybody out, it wasn't going to end. But even now, I see that in this great country, the President Biden has signed off the end of this pandemic. Great. That is great. But at the end, 3 years on, you still have like 20-something% people vaccinated in some countries in Africa and Asia. And here it's more than 70%. So we're safe, but we're not really safe because of that inequity. So here's a local production agenda. We're seeing some positive things. We're seeing WHO coming together with some governments to support South Africa to establish an mRNA platform. By the way, South Africa was able to come up with a vaccine like Moderna's on its own, with no support from Moderna or anybody, within a year of Moderna's innovation. So it's not like there's zero capacity, there's capacity, but there's a lot to build. So there's a hub created in South Africa. I visited it. It's led by an amazing woman, and it is setting up to produce many, many vaccines, treatments, diagnostics using that mRNA technology. But that is at the lab level. To take it to manufacturing, to marketing and distribution all over will take so much more. It will take international institutions such as Gavi, Global Fund, even the big countries, programs such as PEPFAR, to agree to procure from new companies that are now growing on the continent, that are taking technology developed in Africa to develop African products, to buy from them so that they grow. So it will take international solidarity. It will take the Modernas of this world and the Pfizers to share their knowledge as well, so that this platform moves fast to make breakthroughs. It will take South-South collaboration, because it's true, there are southern countries with strong production capacity. India is the pharmacy of the world. Brazil is there. China is there. These countries can partner with a continent like Africa, where production is done, but innovation comes from Africa. You make an African product, you produce it in an Asian factory, you bring it back and distribute it. These are solutions to the production problem, but we must not get to the next pandemic, and it's not an if, it's when. The next pandemic must not hit us when, and we come back to this situation of no gloves, no oxygen, no incubators, no, in some regions, and some regions have and others don't. So these things must start to happen, and it's going to take market integration, technology transfer, capacity of people, young people in the science, in innovation, and these things can happen. And they are beginning to happen, Vanessa. And your country, the American government, is key here, because you are the biggest contributor in global health, in supporting other countries to build their capacity. And that leadership must stay. But we need the whole world coming in together to balance capacity in all regions. Then we'll be prepared as a world. We'll be prepared.
Thank you for that perspective. I think you've been an extraordinary champion over the last 3 years to really tackle governments, corporations, and others to think about how this can be done differently. And certainly, without question, when I think about the work that you're doing and the goal to end the AIDS epidemic, in just a few short years, the ability for local production will build that kind of efficiency and access. I want to take a moment because I am hogging you. So I want the opportunity for the audience to maybe ask some questions. And I have some questions from online as well that I would like to ask you. Are there any questions in the room before I turn to the online audience at all? While I wait for some hands to go up. I have a question. This is another one that's near and dear to my heart, so I'm going to keep taking the prerogative of the lectern to ask you some of these. This is from Claire Birabawa from Uganda for you. How can health equity be achieved in the context of climate change?
Hey, that's a really tough one because the climate impacts that we are seeing today, first of all, are mostly in the developing countries, are harshest in the developing countries. We are seeing, for example, in Africa, the floods that are washing away people's homes and killing people, the droughts that follow the floods, and then the floods that follow the droughts. It's almost like extreme weather is hitting many countries and washing away their hard efforts at development. New roads are washed away, bridges are washed away, and all this from scarce resources that are borrowed. So, but in terms of the health impacts, we are even yet to know what is coming, because like I said, these extreme weather conditions are producing climate refugees, are increasing certain diseases that we thought we had begun to control, forms of malaria, chest infections. We're seeing, and we are still to know the disease burden that is emerging from these adverse weather events that are almost cyclic now. In some countries, it's all the time. So we need to have resilient health systems that are mostly working on prevention, giving people good health, because we know that if your starting point is that of being very healthy, strong and healthy, that you will survive adverse climate or whatever climate shocks come, you survive better, or even economic shocks, all kinds of shocks, you survive better if you have strong immunity and you have had prevention. So turning our health systems towards prevention of disease, in good nutrition, overcoming hunger. Hunger has started to rise again as a result of the multi-crisis. It was declining in the last 10 years. Now it's rising again. So overcoming hunger, nutrition, these are the things that will enable people to survive climate impacts. So your question in short is that we don't know yet how our health is going to be impacted by climate change. We are beginning to see it. And our response must be to invest strongly in health systems and make those health systems reach everyone, inclusive health systems. And because we know with pandemics, they start at your weakest point. Those who are not reached are the ones who succumb. And that is where the pandemics tend to spread from. So until we have health systems that reach everybody, serve people equally, are inclusive, we will not be able to survive and endure the climate impacts.
I think that the approach of the resilient health systems and the ability to respond to the climate emergency, but also meet our burdens of disease and invest in healthy populations, there's a win-win-win across this that I think brings up a lot of what you touched on, which is that there's really a multi-sectoral approach that is based in the values that we bring forth and the values that have to shift for this moment in time. And I think that is what all of our work is going to be, is to begin those conversations, to seed them, to nurture them, and to push for them also through, it's very interesting listening to the planetary health panel earlier, and they're really talking about what it means to create movements. And I think creating movements we're all capable of that, and we're all responsible to that. And I think that that happens on every level, from local up to what we push on a global level as well, and that cascade. We have about 1 minute left. And so I would love for you to just close us out with some either words of wisdom, call to action, final reflections.
Well, I always have to go back to the human rights approach, that we must continue to use a human rights framing in pursuing global health. That health is a human right is the starting point. And that means building healthcare systems that equalize, that give everybody that opportunity, but also that health is seen as, yes, a human right, but seen as and approached in a multi-sectoral way. That our health is not about the health system and going to seek health, but is about us eating well, getting educated and being aware of our health. It's about ending that silent pandemic of violence against women and girls. So it is a multi-sector approach that guarantees the right to health. It starts with human rights. I think that is it, and that we must make this a global public good, that we must accept that the right to health is a right for everyone on this planet, and therefore we must build a new way of delivering these global public goods, whether it's health, education, the environment, ending, stopping the climate crisis, that all of this must be funded publicly by all of us, that every country contributes, every country takes out of the global funds what it needs to solve these problems. That if we take such a global public goods approach, then we can be safe on this planet. No one is safe unless everyone is safe, should be the mantra. We say leave no one behind, but I think we should talk about no one is safe until everyone is safe. This is my last point, that let us use a human rights framing. Let us look at human rights as us as investing in them for everybody, and all of us getting out what we need. That's it, Vanessa. And I thank you so much for the opportunity.
Thank you, Winnie. And we look forward to walking together with you to create this change. And so thank you for your time, and kindly go change all those institutions' minds.
Thank you, Vanessa. I enjoy working with you.
I love it too. More to do. Be well.